Okay, your next question is the maximum pharmacological response that can be produced by a drug, irrespective of dose required, is known as. So it is asking about the greatest effect of a drug that can be produced in the body. Important phrase in this question is maximum pharmacological response. That is the highest effect a drug can produce. Another C, irrespective of dose required. It means it does not matter how much dose is needed. We only care about the maximum effect possible. So the question is asking what do we call the maximum effect of a drug can produce regardless of how much dose is needed to produce it. Okay, so see the option. Here the option is potency, B therapeutic index, C efficacy, D adverse effect. So potency means how much dose of drug is required to produce a particular effect. Two type of a drug, high potency drug or low potency drug. High potency drug, there is small doses needed, and in low potency drug, larger doses needed. For example, drug A produced the pain relief at 5 mg, drug B produced the same pain relief at 50 mg. So drug A is more potent, but potency does not tell the maximum effect. It is only telling about how much dose is needed. So potency is incorrect. Okay, now next option, therapeutic index. Therapeutic index tells us about the safety of a drug. It compares about the toxic effect and effective dose. For example, penicillin has a higher therapeutic index, but therapeutic index does not describe the maximum effect. So it is also incorrect. Now last option C, that is the adverse effect. Adverse effect are a unwanted or harmful effect which is caused by the drug. For example, aspirin can cause gastric irritation, gentamicin can cause kidney damage. So these are a side effect, not the maximum response of the drug. So there is only one option, that is the efficacy. Efficacy means maximum pharmacological effect a drug can produce. It does not depend on the dose. It only describes how much strong the final effect can be. For example, drug A reduces the pain completely. Drug B reduce pain partially. Even if drug B dose is increased, it cannot produce the maximum effect as a drug A. So drug A has a higher efficacy. That's why C option is correct. Now the next question is, deep intramuscular injection using the JETRAC technique is recommended during administration of parenteral iron preparation primarily to. In this question, the question is asking why do nurses use the JETRAC technique when giving the injectable iron? Firstly, we have to know what is the JETRAC technique. The JETRAC technique is an IM injection method where the skin and subcutaneous tissue are pulled to one side before inserting the needle. Because the skin was pulled sideways, the needle path becomes zigzag jet shape. This seals the medication inside the muscle. Now see the option: to enhance the rate of the drug absorption, to reduce the pain at the injection site, C, to prevent the leakage of the drug into the subcutaneous tissue and skin staining, and last one is the increase the bioavailability of the drug. So let's break down all the options. Firstly, C, enhance the rate of drug absorption. This means making the drug absorb faster into the bloodstream. But JETRAC technique is not used to increase the absorption speed. Drug absorption mainly depend upon the blood supply of the muscle and drug property. So this option is incorrect. C, B option, reduce the pain at the injection site. Some technique like slow injection or using a correct needle size may reduce the pain, but the main purpose of the JETRAC is not for the pain reduction. Pain reduction is not the primary reason, so it is also incorrect. Now see the option D, that is the increased bioavailability of the drug. Bioavailability means amount of the drug that reaches the systemic circulation, but IM iron already has a high bioavailability. The JETRAC technique does not change the bioavailability significantly, so this option is also incorrect. Now we have only last option, that is the prevent leakage of the drug into the subcutaneous tissue and skin staining. This is the main purpose. Iron injection can increase the drug leakage, brown staining of the skin, and tissue irritation. JETRAC technique lock the drug inside the muscle, preventing it from moving back through the needle track. Therefore, it prevents the drug leakage and it prevents the skin staining. So this is the correct answer. Now the next, which part of the GI tract show the greatest rate of drug absorption after a oral administration? What the question is asking, when a drug is taken by the mouth, that is from the oral route, it passes through the GI tract. Now the question is asking in which part of the GI tract our drug absorbed the most rapidly. So we need to identify the GI organ where the maximum drug absorption occur. See the option: stomach, large intestine, gallbladder, small intestine. So here the correct answer is obviously option D, that is the small intestine. Most orally administered drugs are absorbed in the small intestine. Why small intestine has the greatest drug absorption? There are three main reasons. First is the very large surface area. The small intestine has a villi and microvilli. So these structures greatly increase the surface area of the absorption. More surface area, more drug absorption. Second condition is rich blood supply. The small intestine has a very good blood circulation. This helps drug enter the bloodstream quickly after the absorption. And third is the thin absorptive membrane. The intestinal wall is thin and highly permeable, allowing the drug to pass easily by the passive diffusion. Now see why the other option is incorrect. Stomach absorb a very few drug. Reason it having a smaller surface area, thick mucus layer, and less efficient absorption. Only a few drug like aspirin and alcohol can partially absorb here. So it is not a greatest site of the absorption. Next is the large intestine. Large intestine mainly absorb the water and electrolyte. Drug absorption here is very slow and limited because surface area is smaller and less blood flow compared to the small intestine. So it is also incorrect. Now the next question is, which of the following statement best describe a placebo? See what the question is asking. The question asks about the correct definition of placebo. A placebo is something that looks like a real medicine, but it does not contain an active drug. So it is mainly used in a clinical research to compare whether a new drug actually works or not. Now see the option: a drug that produces a maximal therapeutic effect. B, a pharmacological active substance used in low doses. C, a substance with no active therapeutic effect used for comparison in clinical trial. D, a drug used to neutralize the toxicity. First option is a drug that produces the maximum therapeutic effect. So this describes the drug efficacy, not a placebo. A placebo does not produce a pharmacological or therapeutic effect. So this option is incorrect. See option B, a pharmacological active substance used in a low dose. A placebo is not a pharmacological active. It contains no active ingredient. So therefore it is also incorrect. See the option D, a drug used to neutralize the toxicity. It is called an antidote. For example, naloxone reverse the opioid overdose. So this is not a placebo. So this option is also incorrect. And now there is a last option, that is a substance with no active therapeutic effect used for the comparison in clinical trial. So this is a correct definition of placebo. Key point: there is no active drug, look like a real medicine, and it is used in a clinical trial for the comparison. Now the next question is, 1 tablespoon is equivalent to. So here are the options: 5 ml, 10 ml, 15 ml, 20 ml. So 1 tablespoon is equal to 15 ml. Now the next question is, 2 teaspoons are approximately equal to 5 ml, 10 ml, 15 ml, 20 ml. So the correct answer is option A, that is the 5 ml. Just memorize it. 1 tablespoon is equal to 5 ml, 1 tablespoon is equal to 15 ml, and 1 ounce is equal to 30 ml. So these conversions are commonly asked in exam like NORCET. Now the next question, in medical prescription, the abbreviation GTT refers to gram, drop, ointment, and tablet. So these are the direct question. Here the correct answer is option B, that is a drop. The abbreviation GTT comes from the Latin word gutta, which means drop. In prescription GTT, when medication are given in the drop form such as eye drop, ear drop, nasal drop. Okay, now the next question is, a patient diagnosed with bacterial infection is prescribed an antibiotic. Which laboratory report should the nurse review to ensure the microorganism causing the infection is susceptible to prescribed drug? The keyword in the question are bacterial infection, antibiotic prescribed, and ensure the microorganism is susceptible. So the nurse must check which test tell whether the bacteria will respond to antibiotic. In other words, which lab test show whether the bacteria are sensitive or resistant to an antibiotic. So see the option: serological test, sensitivity test, serum osmolality, ESR. So here the correct answer is option B, that is a sensitivity test. A sensitivity test determines which antibiotic can effectively kill or inhibit the growth of bacteria. It usually performed along with culture or sensitivity test. Okay, the report showed 3 things, that is the sensitive means antibiotic will work, intermediate moderate effect, and are resistant antibiotic will not work. For example, antibiotic test may include penicillin or ciprofloxacin. So this helps the doctor to choose the correct antibiotic. Now see other option, that is a serological test. A serological test detects the antibodies or antigen in the blood. It is used for the diseases like viral infection, immune disorder, but it does not determine which antibiotic will work against the bacteria. So this option is incorrect. Next is the sensitive serum osmolality. So serum osmolality measures the concentration of solute in the blood. It is used to assess the fluid balance, dehydration, kidney disorder. It has nothing to do with bacterial susceptibility to antibiotic. Now ESR measure inflammation in the body. A high ESR may indicate infection, autoimmune diseases, inflammation, but ESR cannot tell which antibiotic will kill the bacteria. Now the next question is, which of the following statement regarding cephalosporin is incorrect? This question is asking about which statement about cephalosporin is wrong or incorrect. So we must identify the statement that does not correctly describe the cephalosporin. Firstly, at first understand the cephalosporin. So cephalosporin are a group of antibiotic which is used to treat the bacterial infection. Example of the drug may include ceftriaxone, cefotaxime. So they work by inhibiting the bacterial cell wall synthesis, which lead to death of the bacteria. Now see the option. First is they are bacteriostatic antibiotic. So this statement is incorrect. Cephalosporin are bactericidal, not a bacteriostatic. So that's why A is correct answer. Now see other option. They belong to beta-lactam group of the antibiotic. So cephalosporin contain a beta-lactam ring in the chemical structure. Because of this, they belong to beta-lactam antibiotic group. Other drug in this group include the penicillin. So this statement is correct. See, they generally have a broader spectrum of activity than penicillin. Many cephalosporin can act against both gram-positive and gram-negative bacteria. Later generation, like third and fourth generation, have even broader activity than the penicillin. So this statement is also correct. And okay, the next question is, which of the following should be administered along with IV quinine sulfate during the treatment of severe malaria to prevent the hypoglycemia? See the key points in the question. One is severe malaria, B, IV quinine sulfate, and C, prevent the hypoglycemia. So the question is asking which substance should be given with quinine to prevent the low blood sugar, that is the hypoglycemia. There is obviously and correct answer is option D, that is the glucose. Why hypoglycemia occur with quinine? The antimalarial drug quinine sulfate can stimulate the pancreas to release the insulin. More insulin in the body, that can cause increased glucose uptake by cell and decrease in the blood glucose level. So this may lead to hypoglycemia. Because of this risk, glucose solution is often administered with IV quinine to maintain the normal blood sugar level. Other option, calcium gluconate is used for hypocalcemia, hypokalemia, calcium deficiency, so it does not prevent the hypoglycemia. Hydrocortisone, it is used for allergic reaction, right? Multivitamin provide vitamin and nutrient, but they do not control the blood sugar level. That's why there is one option, that is glucose. It's correct. Okay, next question is, which aminoglycoside antibiotic is known to have a widest spectrum of antibacterial activity among the following? Okay, the key part of this question is wide spectrum of antibacterial activity. So the question is asking which aminoglycoside antibiotic can act against the widest range of bacteria. First, understand what is aminoglycoside. Aminoglycoside are the antibiotic which is mainly used to treat the serious gram-negative bacterial infection. So they work by inhibiting the bacterial protein synthesis. Common aminoglycoside may be amikacin, gentamicin, neomycin, streptomycin. So here the correct answer is option A, that is amikacin. Why amikacin is correct? Amikacin has the widest antibacterial spectrum among aminoglycoside. Reason, it is effective against many gram-negative bacteria. It works against bacteria resistant to other aminoglycoside, and it is often used for serious hospital infection. For example, Pseudomonas, Klebsiella, Enterobacter. Therefore, it is a broader spectrum than many other glycoside. Now the next question is, which of the following tetracycline antibiotic does not require dose adjustment in patient with renal impairment? The important keyword are tetracycline antibiotic, renal impairment, that is kidney disease. and does not require dose adjustment. So this question is asking about which tetracycline can be safely used in patient with kidney failure without reducing the dose. So firstly, see the option: doxycycline, minocycline, tetracycline, methacycline. So here the correct answer is option A, that is a doxycycline. Why doxycycline is correct? Doxycycline is mainly eliminated through bile and GI tract, not primarily through the kidney. Because of this, it does not accumulate significantly in renal failure, and dose adjustment is usually not required. That's why doxycycline is preferred in patients with renal impairment. Now see other option: doxycycline. See option B, minocycline. Minocycline is partially metabolized in the liver but still has a renal excretion. Therefore, dose monitoring or adjustment may be required in kidney disease. C is tetracycline. Tetracycline is mainly excreted by the kidney. In renal impairment, drug can accumulate in the body, so risk of toxicity increases. Therefore, dose reduction is required. So this option is also incorrect. Last one is the methacycline. Methacycline is largely eliminated through the kidney, so in kidney disease, dose adjustment is necessary. So this option is also incorrect. Remember this rule: doxycycline is safe in the renal failure because it is eliminated mainly by the liver and bile. Next question is: metronidazole is an effective antibacterial drug for several anaerobic and protozoal infection. So it is used in the treatment of all of the following condition except. The keyword in this question is except. That means find the condition where the metronidazole is not used. Now see the option: H. pylori eradication, pseudomembranous colitis, streptococcal pneumoniae, ulcerative gingivitis. So here the correct answer is option C, that is a streptococcal pneumoniae. Why this is correct? Metronidazole mainly work against the anaerobic bacteria, protozoa. Example of organism: it treats the bactericide Clostridium, Entamoeba histolytica. However, streptococci are the aerobic bacteria, so metronidazole does not work well against them. Therefore, it is not used for streptococcal pneumoniae. Remember this rule: metronidazole work mainly against anaerobes and protozoa. Okay, not useful for aerobic bacteria like streptococcus. That's why final answer is C, that is a streptococcal pneumonia. Okay, next is: a patient receiving a amphotericin B therapy develop increased drug toxicity due to the deficiency of which following cation? Important keyword in this question: amphotericin B therapy, increased drug toxicity, reduction of the cation. So this question asks which electrolyte decrease during amphotericin B therapy and contribute to its toxicity. So C option: magnesium, calcium, sodium, potassium. So here the correct answer is option D, that is the potassium. Why potassium is correct? Amphotericin B is powerful antifungal drug which is used to treat the severe systemic fungal infection. One major side effect is kidney toxicity, that is a nephrotoxicity. Because of kidney damage, the body loses the important electrolytes such as potassium and magnesium. The most important and mainly tested change is hypokalemia, that is a low potassium. Low potassium may cause muscle weakness, cardiac arrhythmia, increased drug toxicity. Therefore, the potassium level must be closely monitored during the amphotericin therapy. Okay, now see other option. Magnesium may also decrease during amphotericin therapy, but it does not primarily electrolyte emphasize in this question exam. See, B option is calcium. Calcium is important for bone and muscle contraction, but amphotericin B does not significantly reduce the calcium level. And sodium regulate the fluid balance. Amphotericin B does not mainly cause sodium depletion. So whenever you see the amphotericin B, think about the nephrotoxicity and hypokalemia, and that's why the final answer is D, option D, that is potassium. Okay, now the next question is: administration of which of the following antibiotic in neonate may lead to gray baby syndrome? So the question is asking which antibiotic cause gray baby syndrome in newborn. Options are chloramphenicol, penicillin, doxycycline, kanamycin. So firstly we have to know what is the gray baby syndrome. So gray baby syndrome is a serious condition that occur in the newborn baby when they receive high doses of drug, that is chloramphenicol. Why it happen? Newborn have an immature liver enzyme, so they cannot properly metabolize the chloramphenicol. This drug accumulate in the body and become toxic. If I am talking about the symptoms, so typical feature may be gray or ashen skin color, vomiting, abdominal distension, low BP, hypothermia, respiratory distress, and circulatory collapse. Because of these severe effects, chlorine and phenicol is generally avoided in the neonate. Now see here that penicillin is commonly used in the newborn infection. It does not cause gray baby syndrome. Doxycycline can cause tooth discoloration and bone growth inhibition in children, but not gray baby syndrome. Last is the kanamycin can cause ototoxicity, that is hearing damage and nephrotoxicity, but does not cause gray baby syndrome. So remember this classic pharmacological rule: chlor and phenicol may lead to gray baby syndrome. So this one is the most frequently asked antibiotic side effect question in exam like NORCET. Now the next question is the drug of choice for the treatment of rheumatic fever caused by streptococcus infection is. The question is asking which antibiotic is primarily used to treat the rheumatic fever which is caused by streptococcus infection. So in rheumatic fever, the infection usually begins with strep throat or pharyngitis. If not treated properly, then it may lead to rheumatic fever, which is affecting the heart, joint, skin, and brain. So see the option: cephalosporin, penicillin, streptomycin, and gentamicin. So if the correct answer is P, that is penicillin. Penicillin is a drug of choice for streptococcal infection. It works by inhibiting the bacterial cell wall synthesis, killing the streptococcus bacteria. For rheumatic fever, doctor commonly use the benzathine penicillin G because it helps to eliminate the streptococcal infection, prevent the reoccurrence of rheumatic fever, and to reduce the risk of rheumatic heart disease. Now see other option: cephalosporin. It can treat the infection and may be used if patient is allergic to penicillin, but they are not the first drug of choice for rheumatic fever. Now streptomycin. Streptomycin is mainly used for tuberculosis and plague. It does not use for streptococcal throat infection. And gentamicin is used for severe gram-negative infection. It does not primary treatment of the rheumatic fever. Now the next question is: all of the following antibiotic act by inhibiting the bacterial protein synthesis except. Okay, so the important word in this question is except. This means find the drug that does not inhibit the bacterial protein synthesis. So options: amikacin, gentamicin, clindamycin, cefotaxime. So the correct answer is option D, that is a cefotaxime. See first amikacin. Amikacin belongs to aminoglycoside group. We have earlier discussed about this. It binds the 30S ribosome subunit. It inhibits the bacterial protein synthesis. So this drug does inhibit the protein synthesis. Second, gentamicin. It is also a aminoglycoside group. It blocks the 30S ribosome and it prevents the protein synthesis. And last, clindamycin. Clindamycin inhibits the bacterial protein synthesis. It binds with 50S ribosomal subunit and stop the peptide chain formation. Therefore, it does inhibit the protein synthesis. So last is the cefotaxime. It belongs to the cephalosporin group and it inhibits the bacterial cell wall synthesis. It does not affect the protein synthesis. So this option is exception. That's why this option is was correct. The complete MCQ discussion for NORCET Pharmacological Series Part 1. I hope this question helped you to understand the concept better. Don't forget to like the video and subscribe to the channel for the NORCET preparation MCQ. See you in the next video with the part 2 of our pharmacological MCQ series. Bye-bye.